So, we got our hands on a pre-mission briefing for nursing students about to face their very first day of clinicals. And let me tell you, it's one of the most intense experiences in all of education. We've boiled it all down into the ultimate survival guide. Let's jump right in. If you picture nursing school as just sitting in lectures, memorizing from textbooks, and maybe practicing on some mannequins, well, you might want to think again. The real education and the real pressure kicks in the second you step out of that classroom and into a real live healthcare facility. And this is not some multiple choice test you can cram for. Nope. This test has no study guide and the stakes are unbelievably high. It's a test of your discipline, your professionalism, and whether you can follow incredibly specific instructions when you're under some serious pressure. So your very first mission is called clinicals. And it's not just an address you plug into your GPS, it's a proving ground. This is the place where all that theory you learned is about to slam right into the messy, unpredictable world of actual patient care. Okay, so here's the scene. You're assigned to the Pine Grove Skilled Nursing Facility, and your guide for this mission, a clinical instructor who makes it very, very clear that she runs an incredibly tight ship. Day one is all orientation, and your survival, literally, depends on following her rules to the letter. The very first set of rules is all about how you look, but this has nothing to do with fashion. In the world of nursing, you have to think of your uniform as your armor. It tells everyone you're professional, it keeps you and your patients safe, and you're repping your entire college. And the level of detail here is, wow, it's intense. Okay, so a simple wedding band, that's allowed. But any kind of necklace or dingly bangle earrings, absolutely not. An Apple Watch is okay, a plain white undershirt is fine. See, this isn't just about looking tidy. It's about getting rid of anything that could get in the way of caring for a patient or even become a safety hazard. And the rules just keep going down to every last detail. If your hair is longer than your shoulders, it has to be tied up. Tattoos? Covered. Your sneakers have to be pure white. Even the cardigan you wear has a rule. It can't be a hoodie. And the reason for that is pretty stark. A confused patient could grab it. Every single one of these rules is there for a very practical, safety-first reason. And in case you were thinking there might be some wiggle room, well, the instructor makes it clear there isn't. She literally tells the students not to come to her with their ivory or off-white sneakers and try to argue that they're white. Her word is final. But out of all these rules, there is one item that is completely non-negotiable: your name badge. The instructor is blunt. She says if you show up without it, just turn around and go home. Because on that day, you're not just you. You are a representative of the entire college. Okay, so you've nailed the uniform, you're looking the part. Now you just have to get there. And believe it or not, just showing up on time and in the right place is the next part of your test. The call time is 7 a.m. sharp, not 7:01, not 7:02. The instructor is so serious about this, she actually advises students to do a practice run and drive to the facility over the weekend just so they know the route and exactly what the parking situation is like. And the logistics themselves are critical. For instance, whatever you do, do not park in the CVS lot next door. You'll get a ticket. You have to park on the street, and you better read the street cleaning signs. And don't bring your school backpack. There's nowhere to store it. You have to leave it in your car. Oh, and you absolutely must bring a water bottle. The instructor insists on it, saying, if you don't drink water, you're anxious. So, once you're actually there, the check-in procedure is super precise. You meet at the front entrance, you use the facility's kiosk to sign in and print out a visitor sticker. Then, you place that sticker on your uniform, but, and this is important, you have to make sure it doesn't cover your official college name badge. Apparently, one student did that, and the instructor asked him, why? Are you ashamed to be the student? All right, so beyond the day-to-day stuff, every healthcare facility has what the instructor calls secret codes. These are basically the emergency plans for unexpected, really high-stakes situations. And the big secret code for this particular facility is something called a complaint survey. Here's what that means. If a resident files an official complaint about anything from cold food to rude staff, a state surveyor will show up, totally unannounced, within 24 hours to investigate everything. It is a huge deal for the facility. So let's just imagine for a second, what would happen if that surprise state inspector walked in on your very first day? What's the protocol? Do you try to help? Do you hide? What are you supposed to do? The answer is actually really simple and kind of shocking. The day is over. Immediately, the instructor will pull the entire student group out of the building, send everyone home, and assign homework instead. Mission aborted. And this brings us to what is really the final and probably the most profound lesson of the entire day. This one goes way beyond uniforms and schedules. It's about really understanding your role and your limits. Of course, the students are there to learn all the practical, hands-on skills, like how to do a full head-to-toe patient assessment. But the instructor makes it really clear that before any of that, the single most crucial skill you have to master is simply how you introduce yourself to a patient, correctly and honestly. And this right here is the core principle of the whole briefing. The instructor commands them, do not ever, ever introduce yourself as the nurse. You state your name and you say you are the nursing student from your college. It's about ethics, it's about the law, it's about professional integrity. You simply haven't earned that title yet. You know, hearing about all these intense, demanding rules, it leaves you with one big question. This kind of extreme discipline, it's not just random. It's all about building the foundation for a career where the smallest details can literally have life or death consequences. So what does all this really tell us about the immense responsibility that sits at the very heart of being a nurse?